Good morning, doctors. Today we are going to discuss about Parkinsonism and Parkinson's disease. Is a disease of nigrostriatal pathway. Parkinson is a disease of nigrostriatal pathway. There are two neurotransmitters include dopamine and acetylcholine. And what was happen in Parkinsonism? There is decrease in dopamine. So, if we want to treat this Parkinsonism, we have to give dopamine secreting drugs, or we there is a disbalance dopamine decrease or acetylcholine increases, so we can give anticholinergic also sometimes if we are not going to use dopamine to balance between both. Okay. Now, what are the causes of Parkinsonism? First one, the most common is idiopathic. Nobody knows. It's elderly age, we can say Parkinson disease. Now, another one is head injury, any trauma. It is also known as punch drunk state. Okay, somewhat some metal like Wilson disease, excess accumulation of copper. Wilson disease is autosomal recessive disorder, or we see here liver dysfunction. So we need to do, if we find Parkinson like symptoms in a patient, need to go for LFT. If LFT is abnormal, see his eye examination, Kesher-Flexner ring. Wilson disease is more common in age below 40 years. Okay. Another cause is antidopaminergic drugs like metoclopramide, or we can say haloperidol, antipsychotics used in schizophrenia. What is the trade of Parkinsonism is HRT. This three treat HRT, hormone replacement therapy. It's a mnemonic. Okay, HRT. H for hypokinesia, R for rigidity, T for tremor. HRT. What kind of rigidity here? It's cogwheel rigidity, mainly found in wrist. And tremors are resting tremors. Firstly, they are unilateral, then bilateral pill rolling tremor. This is we find here. And what kind of tremor? How to differentiate these are the Parkinson tremor or essential tremor. In case of essential tremor, what was happen? It became severe tremor when you are working, but at rest it's normal. But in Parkinsonism, at rest when you are sleeping, the tremors were there, but in essential not. Okay. And what are the other features like mask-like face, micrographia, orthostasis means postural hypotension. When you stand up, the blood pressure falls. Cognitive late features and memory loss. Fascinating gait. Okay. Hope till here it's clear. And today we are going to discuss about MCQs on Parkinsonism also. Decreased blinking plate, normal reflexes, sensation, and muscle power. Investigation by clinical diagnosis. Go for clinical diagnosis or go for electrolytes. Sometimes sodium level hypernatremia occurs. It causes Parkinson like symptoms, tremors, and such. Sometimes excess copper accumulation. Go for lab and then identify. Sometimes calcium in our body responsible for Parkinson like symptoms. And go for dead skin. Dead skin is the best to differentiate between Parkinson and some other disorders. Or sometimes there is no Parkinsonism, then go for MRI of brain as compared to CT scan. MRI is also best to differentiate some other disorders to differential diagnosis. We can use anticholinergic here like benchtropine for anticholinergic, or dopamine agonist like levodopa, carbidopa, or sometimes we can use combo of both levo and carbidopa. The brand name is Syndopa, or amantadine we can use. and sometimes we can use non-ergot alkaloids like pramipexole, cabergoline, rotigolene, ropinirole. Okay, and ergot alkaloids are pergolide, bromocriptine, ergot alkaloid. COMT inhibitor, sometime we can use tolcapone, anticapone. These are also. Firstly, we have to do the theory of this topic. This is very, very important. You can see in your practice, in your OPD. In even yesterday, I found same patient of Parkinsonism. That's why I really don't go for in that case. Like that scan, but I decide to do sodium electrolyte. Sodium is normal, LFT, his LFT is normal, serum calcium it's normal. Sometimes I decide to take even TSH also. TSH reports today I'm going to get, and serum prolactin today I'm going to get, and his MRI I decide to do. So you can find such live cases, and then I will decide how to treat that patient. Age is 65 years. Clinical cases also, it's very much interesting when you are going to watch clinical cases with theory. MAO B inhibitor is salicylic and resaziline. Or nowadays a special technique like deep brain stimulation surgery, it's very high frequency subthalamic nucleus. We can go for this also, very helpful after that. Now prevention by MAO B inhibitor or CoQ enzyme. CoQ enzyme is also used in dilated cardiomyopathy. Antipsychotics like clozapine and quetiapine we have to stop in such patients. Those who are on antipsychotics, yeah, mild. I will give you one example. If a male is less than 60 years, need to give anticholinergic. Side effects of levodopa, carbidopa is constipation, dizziness, mouth and urine retention, mouth dryness, urine retention, constipation. In my patient, constipation already present. So levodopa and carbidopa aggravates the constipation, but his age is more. So I have to go for dopamine. Now, age is more than 60 years, severe symptoms, go for levodopa, carbidopa is effective. Pramipexole or cabergoline, we can start, no problem. Now, levodopa increases on and off phenomena, level down. We see on and off phenomena when you give excess levodopa. MAO-B inhibitor or COMT inhibition we can use in such case. Not take cheese because cheese contain tyramine, it causes severe hypertension. Or we can go for DBS surgery. So guys, I hope it's very much clear for you till here, and I am going to speak little one about DBS. DBS is a surgery. Upper brain we do little hole, and through there wire is passes, then wire attached and it connected with a battery. This is DBS and helps in reversal. So thank you, good day and goodbye.